morning. My name is Rita Chappelle. I'm Chief of Medical Media and External Affairs here at the Philadelphia VA Medical Center, and we're so happy to have you all here today. It's my pleasure to introduce our Medical Center Director, Rear Admiral Karen Flattery Oxler, the first female head of the Philadelphia VA Medical Center. Karen, I'll turn it over to you.
Thanks, Rita. Well, good afternoon, everyone, and it's a great day to be here in Philadelphia, and also a great day to be here at the Corporal Michael J. Crescenz VA Medical Center. All right, so I was going to pause there for a moment, but I won't. We're really excited to partner with the City of Philadelphia to provide support during this pandemic and be able to be a site for vaccinations for Philadelphians. We kicked off our first clinic this afternoon, and this is part of our fourth mission that we're able to do. When authorized to do so, we are providing the site for vaccination. We are also providing some team members to support this effort. We've been at this, like all of you, for quite a period of time. The VA here in Philadelphia has administered 47,000 vaccines. That's to veterans, to some of their family members and spouses, and most recently to other caregivers. So we're really excited to be able to host and help extend some of the work that's needed during this pandemic. So I'm excited to partner with Dr. Farley and the team here in Philadelphia, and our team couldn't be prouder than to be here where we work, where we live, and be able to provide support to some of our other team members here in the Philadelphia area. So Dr. Farley, I'm going to turn it over to you. Thank you.
Great. Thanks very much. Before we talk about vaccination, I have to remind people again that the virus is still here. As a matter of fact, case rates for the virus are still rising in Philadelphia, and the virus is still deadly, which means that vaccination is more important than ever. Now, the more sites we have for people to be vaccinated, the easier it is for everyone to get vaccinated, and the more that we're all protected. We're all protected when other people get vaccinated. So a vaccine is now available in the city through hospitals, through federally qualified health centers and other clinics, through an increasing number of pharmacies, through community providers like the Black Doctors COVID Consortium, through the Center City Vaccination Center at the Convention Center, and at Esperanza in North Philadelphia, which we opened up last week. And the city itself has operated 9 neighborhood clinics across the city. Some pharmacies and some hospitals are also operating off-site vaccination clinics, special clinics that they offer to people who are not necessarily their patients. So some time ago, the Veterans Administration approached us and they said they wanted to do the same, that they had were drawing to close the vaccination of their own patients, and they wanted to offer vaccination to other residents of Philadelphia. We thought that was a great idea, that they could serve a larger community. The people who you probably saw when you came in here today waiting in line for vaccination are people who put their names in our database, the Vaccine Interest Database, saying that they wanted to be vaccinated, and they have been invited to come here to the VA to be vaccinated. This week, people who come here for this vaccination clinic will be vaccinated using the Moderna vaccine. That's a 2-dose vaccine that's given 4 weeks apart. These people that are vaccinated here today, then we'll be back 4 weeks from now. This will go on for about a week. Today, my understanding is that there's the capacity to vaccinate about 200 people, and then it will increase to about 300 people per day, every day. And then we'll see after this week whether there's enough vaccine, the Johnson & Johnson, to be used in the next 2 weeks. And then 4 weeks from now, we're going to be back here with the Moderna vaccine. So, it's just a few hundred a day, but with each person we vaccinate, we're one person closer to ending the epidemic. So I just want to thank the people at the Veterans Administration. They didn't have to do this, but they're doing this for the city of Philadelphia. It's a great thing, and it's one of the many efforts that are going to take us to the end of this epidemic. With that, I'll stop and see if anybody has any questions.
Yes, if you have any questions, please feel free. If you have a question.
What's the procedure here to get a vaccine? How tough is it?
We should ask the folks out there maybe, but I think it's not hard. They put their name in the database. They're going to get an email, a text, and a phone call offering them to schedule, and they can schedule at a number of sites, this being one of them. And then they can call or go online and schedule an appointment. They come here to have the appointment. It's the same process we're using for the other clinics that we are either running around the city or we're doing coordination with other organizations like the VA around the city.
Karen, would you like to add on to that?
So no, simple. We thought a simple process was the best approach, and we had 200 people sign up quickly, 200 plus or more signed up to the world, and we're ready to roll.
Do we have another question?
Planeamos vacinar a las gentes que están aquí.
In conversation with the City of Philadelphia and the VA, we've been able to create a partnership that will allow us to vaccinate some of the Philadelphians who reside in the local community, who've signed up for vaccines.
En la administración de la salud de veteranos y la ciudad estamos acompañados para vacinar a la gente que vive en el vecindario de veteranos.
Prior to today, we have vaccinated our veterans, their family members, spouses, and we have given over 47,000 vaccines.
Antes de hoy hemos vacunado a las familias de veteranos y hoy en día total es 47,000 personas.
Well, that was our first and important mission. We understood as well that we could provide support to others through our fourth mission, so we were asked to do that.
Esa fue la primera misión, pero con la cuarta misión hemos estado pendiente para vacunar más personas.
We anticipate that this week we will vaccinate over 1,000 Philadelphians with Moderna, which is the vaccine that is being administered. And then those team members, the Philadelphians, will be back in 4 weeks for that second dose.
Anticipamos vacunar a más de 1,000 personas esta semana y en 4 semanas volverán para la segunda dosis.
So the partnership between the federal government and the city of Philadelphia is vital as we look at this pandemic and we look at ways to reduce the need for continued vaccinations and to take care of those that we serve and we live alongside.
La relación entre la Administración de Salud de Veteranos y la ciudad de Filadelfia es muy importante a medida que vamos vacunando a las personas que más lo necesitan.
So while we start the vaccination clinic today, we know we will learn more today, and we will be ready for what is ahead, and we look forward to that continued partnership.
Y mientras empezamos hoy a vacunar a las personas, sabemos que es una experiencia que vamos a mirar diariamente para seguir vacunando a las personas para que no no se contagien con el virus.
Thank you. You want Dr. Farley? Yes, please.
Buenos días, hoy nos encontramos en la Administración de Salud de Veteranos y el doctor Farley recuerda a todos que las tasas de casos están aumentando. El virus sigue aquí y sigue siendo mortal. Vacunarse es tan importante como siempre. Entre más sitios están disponibles, más fácil será para todos vacunarse y cuanto más estemos protegidos todos. La vacuna ya está disponible a través de hospitales, centros de salud calificados federalmente y otras clínicas, farmacias, proveedores comunitarios como el Black Doctors COVID Consortium, centro de vacunación de la ciudad en el centro de convenciones y en Esperanza en el norte de Filadelfia y clínicas operadas por la ciudad en 9 áreas de la ciudad. Las farmacias y algunos hospitales han gestionado clínicas especiales fuera del sitio. La Administración de Veteranos ofreció ayudar estableciendo su propia clínica, donde estamos hoy, así que podemos servir a una comunidad más grande. Las personas que están invitadas son elegibles de la base de datos de interés de vacunas que está operada por la ciudad. Esta semana vamos a ofrecer la vacuna de Moderna. La gente volverá 4 semanas después para recibir su segunda dosis. El calendario después dependerá de la disponibilidad de vacunas. Hoy la capacidad para vacunar va a ser a 200 personas y después de eso vamos a tratar de vacunar 300 personas semanalmente. Con cada vacuna estamos una persona más cerca de poner fin a esta epidemia. Muchas gracias.